Dr. Albert again. So today's topic is about the ovarian cyst, and it become more and more popular not only in younger people, but also for older women. Like my mother had a huge ovarian cyst, and she also has liver cyst. She had a kidney cyst. The cyst itself is not dangerous, but if there is inflammation involved, then eventually it can mutate the gene. So to avoid the cyst to grow too fast, then that can prevent the cancer development. Like I had a very small ovarian cyst, but the MRI shows that their report is very interesting. They would say it looks benign, but it could have low tendency to develop malignant. So they covered every single basis. Everything can have potential to develop a malignant, right?
Even a normal cell.
Yes, exactly. Yes. So if we can control the ovarian cyst to grow too fast, or not with the inflammation, if we can optimize the inflammation level, then it will reduces the chances of the cancer, right?
Right, and I think a lot of this is caused by hormonal imbalances, right?
Yes.
From a lot of chemicals in the environment, potentially plastics, other things that affect receptors for hormones.
Yes, you said you also mentioned the protein combining with the testosterone, with the estrogen, right?
Right, the sex hormone binding globulin kind of regulates the free levels of testosterone. But I think that there's so many factors involved. You know, there's a few things that people can do to kind of help regulate their hormone levels if they're struggling with these irregularities, like menstrual cycle irregularities, which can be caused by many different things.
Yes.
But that, or some of the facial hair abnormality features that come with polycystic ovarian syndrome sometimes can be improved with maybe black seeds or Nigella sativa, black cumin. So there was a study in 2024 that showed that 1,000 milligrams of that black seeds or black seed oil was more effective than medroxyprogesterone, which is a type of contraceptive that's typically used to treat polycystic ovarian syndrome.
What is
PCOS.
that?
Contraceptive. It's a type of contraceptive.
What is that? The testosterone, that particular?
The medroxyprogesterone. It's the type of progesterone.
Oh, progesterone.
Right,
Okay.
So, but sometimes they use that to treat polycystic ovarian syndrome. And so over a couple months of comparing the two, it seemed like the black seed oil was more effective. Interestingly, improving menstrual regularities, some of the abnormal facial hair, and the hormone levels.
Yes. So polycystic ovarian syndrome happens a lot in the younger women because when they eat a lot of sweets and the insulin level go up, and then the insulin stimulates the ovarian cyst to grow, so they develop multi-cyst in their ovaries, and that's one of the causes of infertility. And then they have irregular period with the facial hair grow, but I noticed that the PCOS traditionally occurs to women who are overweight, but now with a thinner women, they exercise, but they still eat ice cream, cookies, which cause the high insulin level. They're not overweight by any means, but they could be diagnosed as PCOS.
Right. Well, sometimes the fat tissue can cause more estrogen conversion, right? So that people who are heavier tend to have higher estrogen levels, or have the hormone levels be a little bit out of balance because of that.
Yes. And if you have higher estrogen, and if the enzyme converted from estrogen to testosterone, then that can increase your testosterone level. So that can cause this whole 9-yard cyst. But for older women, like after menopause, they also tend to have cyst. I think because one of my gynecologists told me because our estrogen level is very low, especially for thinner women, and but the ovary still produce a little bit of testosterone. So you would, I observed my mom has some facial hair growing on the lips, and she's very skinny. She was, but she has a gigantic cyst in the ovary, which produced testosterone. So that cyst, if my mother eats very healthy, but with this big cyst, if she eats junk food, then it could potentially convert it to malignant.
Yeah, and I think stress plays a big role.
Yes,
also.
stress definitely. Yeah, there is a German study. They use electric acupuncture to help regulate the period for younger women, so they can ovulate regularly. And the herbs you mentioned for PCOS?
So another one is spearmint. So spearmint tea, studied over the course of a month when the participants drank this daily, was significantly more effective than placebo at improving hormone levels in women with these hormone irregularities, like too much testosterone, too much or too little estrogen.
Yes,
right?
Yes.
And some of these other imbalances, like the follicle stimulating hormone and luteinizing hormone.
Yes. So you think, I'm treating many younger women with infertility. So do you think the spearmint or the black seed?
I think the spearmint would be a great thing to start with. I think it's very safe, but I think a lot of women have infertility because of stress.
Yes.
In modern society, it's hard. It's really difficult to regulate stress levels.
Yes.
Right?
Yes. Thank you.
Thank you.